Hi, and welcome to this segment on A Minute with Mandy, where we're going to talk about the best sleeping positions during pregnancy. Now, in a previous video, I talked about how to sit if you've got pain during pregnancy, because sitting is a really common activity. But if we go back to that idea about considering your day as a 24-hour clock, what habits do you spend the most time in? Sleeping is one of those really important habits. We spend a lot of time of our day sleeping, and sleeping commonly can be a position or a time we spend that's uncomfortable during pregnancy, and that often can increase our pain if we're having pelvic girdle pain during pregnancy. Now, most commonly, it's recommended for women to sleep on their sides during pregnancy, and commonly the left side. I'm demonstrating on my right for today, but you could equally apply these principles to your left. So, if I'm sleeping on my side, what are we looking at? Well, we're going to consider this knee position again. Unfortunately, here my knees are really close together, and in that previous video about sitting, we talked about the importance of keeping your knees wide apart. That's hard to do with sitting, but ideally we would have enough space between our knees that the knee would be at the same height as the top of the pelvis, all right? That's going to help just maintain a little bit more stability while you're sleeping. So knees together, not ideal, and lots of women actually like to roll forward and bring their knee down on the bed. That's even worse. When we're in this position, the weight of the thigh bone of the femur is pulling down, gravity pulls it down to the bed, and it's increasing the tension on our poor SI joints in the back, and it's compressing the pubic bone in the front. So this isn't ideal either. One common fix that's recommended is simply for women to put a pillow in between their knees. This is going to help. We're going to add a little bit more distance between the knees. And if you have a fat pillow, it might even get you up high enough. But the problem is, pillows are soft and squishy, and through the course of the night they compress. So often by the end of the night or in the morning, your knees aren't really apart anymore. And with a pillow, it's pretty easy to just slip forward into that non-optimal position with our knee down on the bed as well. So pillows might help a little bit, but they actually aren't my favorite. Another common remedy that's recommended are those pregnancy pillows. So I've got a Snuggle here, okay? Snuggles are often touted to be really much more comfortable because they support more body parts. So you can support your head and neck. You can even put your belly on here if you need a little bit of belly support, and then it's got this piece that wraps around behind that you can put your knees on as well. So, although I might look comfy to start, it's the same problem. It's really squishy. My knees are going to compress down, and throughout the course of the night, I'm not going to be as well supported. So, my favorite thing to use for sleeping during pregnancy is a yoga bolster. Here's my favorite yoga bolster. It's nice and wide. The reason I find bolsters are better is because they're dense. They don't compress with the weight of the leg through the course of the evening. So now I'm on my side. I'll move the bolster so you can see this. I'm going to keep my bottom leg straight, and I'm going to line the bolster up right with that bottom leg. And then I'm bringing my top knee and shin on top. This is really nice because it's typically wider than a regular pillow. It's not going to compress, and it allows me to support my knee, my shin, and my foot. With this kind of support, I'm not as easily able to roll forward and get over that. That's probably not going to happen. I'm going to maintain the support for my SI joints in the back and take some of the compression off the pubic joint in the front. So, bolsters are my favorite. Now, I understand that not everyone can go out and get a yoga bolster. They can be expensive. So, we can do a quick fix with a quilt. Here you can see my lovely quilt. And I do mean a quilt that's been sort of stitched and the material is thinner, and not a comforter, because comforters will compress in the same way. But if you've got a denser material, you can roll it up, okay? And I often recommend duct taping it so it doesn't wiggle out on you and unravel. But it can work much the same way. So it's nice and tall, and then I can rest my knee, shin, and foot on here, and it's not going to compress during the night because it's denser. And with blankets, you have the opportunity to roll more up if you need more height, or use a smaller one if you need less height. And you can play with it then so that you're more comfortable. So that's a really nice option too. Yoga bolsters or a rolled up quilt. Lastly, if you just can't get comfortable with something between your knees, because some women can't, and you gotta stack them, there's one small trick you can use to tweak your stack to be more supportive for your pelvis. So when I'm lying on my side like this with my knees together, because I'm just not a person who likes anything between them, the trick is to take your top foot and let it rest behind the bottom on the bed, okay? Not forward in front, right? We're not doing that. We're keeping our knees stacked and the top foot back on the bed. What this does is causes a slight external rotation of the femur, of the thigh, rounding out. And when it does that, it just lends a little bit more support to the pelvis in the back. So this would be another alternative to try if you were getting that discomfort during pregnancy. Hopefully one of these tips works for you.